Good morning, and thank you for joining us today as we kick off Heart Health Month. The Alabama Department of Public Health and Baptist Health Systems and the American Heart Association have teamed up to raise awareness for cardiovascular disease. We're going to open our program this morning with Dr. Tom Miller, State Health Officer, followed by Elizabeth Williams with Baptist Health Systems, and then Brittany Garner with the Alabama American Heart Association. Dr. Miller?
Thank you so much. Good morning. Thank you for joining us for the 2017 American Heart Month kickoff. February is actually American Heart Month, and it's a great time to commit to a healthy lifestyle and to make those small, sustainable changes that can lead to a lifetime of heart health. We're very pleased to partner with the American Heart Association to increase awareness of the issue, specifically around women and heart disease, and to observe the Go Red for Women's movement National Wear Red Day. Since its inception 15 years ago, National Wear Red Day has helped millions of women make positive strides towards better health outcomes. More women are adopting heart-healthy behaviors like exercise, healthier diets, weight loss, and preventive screenings. As a result, nearly 300 fewer women die from heart disease and stroke every day, and we have seen a decrease in women's deaths over the past 10 years. According to the Centers for Disease Control and Prevention, 1 out of every 4 female deaths in 2013 was due to cardiovascular disease, but only just over half, 54% of women recognize that heart disease is the leading cause of death among them. Cardiovascular disease is actually an umbrella term for a number of conditions that affect the heart and the blood vessels. These include heart failure, arrhythmia, heart valve problems, heart attack, and stroke, all forms of cardiovascular disease. Hypertension or abnormally high blood pressure, a common condition, is one in which long-term force of blood against artery walls is high enough that it may eventually lead to problems that cause heart disease. Blood pressure is considered abnormal when the systolic or diastolic, the top and bottom numbers, are consistently over 120/80. High blood pressure can be controlled with medication, self-monitoring, diet, exercise, and gradual lifestyle changes. High blood pressure costs the nation $46 billion each year. This includes the cost of health care services, medications to treat high blood pressure, and factors in the days missed from the work site. According to data from the 2015 Behavioral Risk Factor Surveillance System, more than 40% of Alabamians suffer from high blood pressure. Those who suffer from heart disease are at greater risk for developing kidney disease, diabetes, chronic obstructive pulmonary disease, sleep-related disorders like sleep apnea, anemia, and other comorbidities. We are making great strides towards better population health, but cardiovascular disease does continue to be the leading cause of death in Alabama and the country. In 2014, in fact, more than 12,400 Alabamians died because of heart disease. The agency's cardiovascular health program, the health department's program, has a mission of providing leadership in Alabama to prevent the death and disability that comes from heart disease and stroke, and to focus in particular on disparities in health and health care, and to work with all of our partners to fully implement a plan that focuses on policy and system changes in the work site, the health care, and the community settings. In 2016, we hosted the 2016 Blood Pressure Control for Better Health satellite program, which was to provide nurses, social workers, clinicians, public health staff, and pharmacists with practical steps for helping their patients and clients and the public with blood pressure control. When you look at the most effective ways to combat heart disease, it's to prevent it from occurring in the first place. Heart disease can often be prevented by identifying the risk factors. These are primarily high blood pressure, as mentioned, high cholesterol, diabetes, and smoking. These risk factors continue to put more people at risk for heart disease and stroke. To address these risk factors, we focus on the ABCs of cardiovascular disease prevention. The first is A, aspirin use. And you need to talk to your provider about using aspirin, either 81 milligrams on a daily basis or the stronger dose, 325 milligrams, which is generally taken every other day. But talk to your provider first. Don't just go out and start taking it. The second B is blood pressure. We mentioned the abnormal values being over 120 over 80 consistently. A big area to impact blood pressure is by looking at your sodium consumption. And C stands for the cholesterol. Total cholesterol is ideally under 200, and LDL, that's the bad cholesterol, ideally should be under 100. And finally, in the ABCs, smoking. Smoking cessation is something that we can assist you with through our Quit line. This helps to enable an individual who is trying to quit smoking with medication and counseling, and using a partner on the Quit line increases the abstinence rates among those individuals that access this service. So ask your provider about quitting, and in particular using the 1-800-QUIT-NOW line. That information is also available on our agency's website. So, by living a healthy lifestyle, you can help keep your blood pressure, cholesterol, blood glucose normal, lower your heart attack risk and your stroke risk, and if you happen to be a healthcare provider with patients with high blood pressure, we encourage you to talk to them about participating in community-based programs that address health and fitness, and also to work with other physicians to provide a specialized team-based care approach to the treatment. So finally, in closing, I challenge each of you individually to know your own personal risk for heart disease and to take action to reduce those risks. And remember, small baby steps add up. So I encourage you not to try to do it all at once in general, but always look for those baby steps and have those successes that you can not only feel good about, but also build upon while making a real difference in your long-term health. So with that, thank you, and I'll turn it over to you're next on the list.
Good morning. I'm Elizabeth Williams, the Community Events Manager for Baptist Health, and this is such a big deal for us. We see patients every single day, and I think that somehow the awareness of heart disease for women has often been made less of a big deal than it really is, and I think that's so important for what we're doing today with Wear Red Day. It's a national thing, and the statistics are so huge that it's the #1 killer of women, and we sometimes don't think about in the rush of our day how busy we are, the symptoms that we have, and that we keep on going because we're women and we're strong and we can do this and we take care of everybody else. But it's so important to take care of ourselves. And one thing that Baptist Health is really, really big on is getting screened. What are your numbers? Tomorrow we will actually be having a Love Your Heart screening that will be held at Baptist South. And what we'll do there, we will actually do a resting EKG that will be read by a cardiologist. That's a huge deal. We'll be doing blood pressure and blood sugar and cholesterol screenings. There's no reason that we can't take better care of our bodies. There's no reason that these statistics have to go on. And even though things have improved, even though women are going to the doctor and asking those questions about their heart health, it's so important that we continue to make strides because it's still the #1 killer. And to me, that just needs to really, really decrease. Something needs to be done. So this is just the kickoff, you guys. February is Heart Month, and so let's not just look at this day and wear our red and post a whole bunch of things about what today is, but let's think about this entire month. And we're starting right at the beginning, but at the very end, we're going to do the Red Dress Dash. And that's with the American Heart Association. It will be held at Baptist Health at our DeBoer building on February 25th. So, I mean, you can't not take a part in something that's going on this month in order to make some real big changes for heart health. I don't want daughters and mothers to lose more women to this disease. It just does not need to happen. So look for more information all month long about the things that we're doing to help our community, and we want you guys to get out there and help yourselves. Just take those small steps, like Dr. Miller said, in order to make some big changes in lives so that we don't have to lose more people to this, and we don't have to lose more women who are heading our households to this. So thank you very much.
Well, first of all, I want to thank the Department of Health and Baptist Health for being here today. We cannot do this alone. Today we celebrate National Go Red Day. Like what was mentioned before, starts the kickoff of a month-long campaign to raise awareness for the #1 killer of women. Again, the #1 killer of women. We wear red today to show and to tell others that this disease affects everyone. Today we're focusing on women, but it also affects males as well. CVD and stroke cause 1 in every 3 women's death each year. But together we can change this epidemic that people have referenced before in the press conference. But we need each of you. First, today you can wear something simple as wearing a red jacket, a red pin to show awareness to the American Heart Association. You can also donate on our website and through social media. You can also tell your story through social media. If you are affected personally, we'd love to have your story shared through our social media channels. But like Baptist referenced earlier, it's not just one day. It's 65 days out of the year to remember the Heart Association and to remember the fight for women. So I challenge each of you each day to think about your heart health, whether it's making small steps that Dr. Miller talked about, or whether it's making life drastic changes or telling others about the great work that the American Heart Association is doing. But again, without you, we cannot make this possible. So I want to thank all of our sponsors and folks that were here today. Thank you.
Thank you so much, and thank you, Elizabeth and Brittany and Dr. Miller, for joining us today. Is there any questions from anybody? If not, this concludes our program. Thank you.